What's been interesting to me is, the three of us met virtually through a documentary with the open patient. And it wasn't until I saw the full documentary, which, included me, Stephen Keating, and then Open Notes and you guys, that I learned about progress notes, open progress notes, which is what Open Notes has been studying. I had to be in a documentary to learn about what is truly in my medical record.
So Jan and I have been working together for maybe 30 years, long fascinated by the issues of communication between patients, families, doctors, nurses. And when we met you, Liz, it was really an extraordinary experience being in the film together, hearing your point of view as a patient with a potentially awful disease. It led us to invite you to join us in Salzburg, where we had an international seminar addressing transparent communication in healthcare. And you were so extraordinary at that meeting as we made you an offer right on the spot to join us. And it's been quite an adventure working with you ever since.
One of the main struggles at Salzburg Global Seminar was, how do we help the public understand these concepts? And the solutions being generated by the groups were, we should write a paper. We should write a paper and publish in the academic journals. And I was like, excuse me, as a person who's here as a regular human, I don't have access to those journals. I will never read those journals. So how would we get that information out to regular people? Maybe this should be in, on Facebook. Maybe this should be in the USA Today.
Well, the trick is now to get people to understand what's happened. A law has been passed. It says thou shalt have access to everything the doctor writes about you. And yet very, very few people in the world know about it.
The Cures Act basically solved the problem of getting providers to share their notes with patients. And for patients, this is a huge breakthrough. The Cures Act has one more regulation that hasn't gone into effect yet, and that will happen in December of 22, when providers must not only allow patients access to their medical records, but they have to be able to easily download their records into apps. And, once something's in an app on your phone, for example, it's a lot more visible to you. And I suspect maybe at that point, it will really, truly become universal.
All these hospitals and health systems need to make it technically possible for patients like me to gather my information from multiple places, and I will be able to share it with whomever I want. But I'm concerned that once that information leaves my health system, once it goes to my phone or some third-party app, those apps don't have the same requirements to keep my information private. And privacy policies and terms and conditions can change anytime.
We've learned a lot, but we've also learned that a lot of this is really hard. And that's what Liz is alluding to in the issue of privacy. Privacy is really complicated. I've long had the sense that people want everything to be private until they're sick. And then when they're sick, they want nothing to be private, but they want everything to be out there so they can get the best care they can. So there's a paradox there. There's stuff you want to be private about. Maybe I want my kids to read part of my note, but not everything. Maybe there's some things I don't want them to know about, but there are other things that it's really important that they understand. This is not simple stuff, which is why we have so much fun with it. What's fascinating to me is that in a big study we did of doctors and nurses who'd been using the Open Notes for more than a year, 25% of them told us that a patient had found an important error, an error that they found important. And if a doctor will say that about his or her own records, that's important stuff. The patient safety elements, I think, are very striking and real.
If somebody's watching right now and they're trying to understand access to the record and why checking out open progress notes is important, what would you tell them to get started?
Well, I tell them that if you can find your note, which won't be so easy, you'll find it's really good medicine. You'll do better with your healthcare. You'll have a better outcome over time. By the same token, I'll say to my colleagues, the doctors, get over your fear of this. Begin to write notes to patients that live up to your word. Doctor means teacher. Teach your patients what you're thinking.
I would encourage patients to get online and familiarize yourself with your record. And then you can decide what's most important in there for you. You know, it's nice to have access to all this information, but you need to familiarize yourself with it. And then, I think probably most patients will concentrate on 1 or 2 or 3 things that they'll really pay attention to.
I am passionately curious. And when I think about my work with Open Notes, I came into it thinking I had no special talent. But I now understand that the perspective I bring is a special talent, that the curiosity is the talent. And I believe people are curious about their health, but we haven't had all of the tools and information we need in order to completely make informed decisions about our health. I think a lot of that will change in the coming years.